Behind locked doors, barricades, fences, and razor wire in a barren room, about 40 men sit in Tan County Jail uniforms, unwrapping their innermost feelings, fears, and fixations.
It destroyed a lot of bonds in my life, a lot of relationships, employment, housing, and I felt myself going deeper and deeper and digging a hole that I couldn't get out of until I found the SMART program. I found treatment. I got myself help.
Ridian Walton lost his mother and brother to opioid overdoses. He and his fellow inmates here are part of the Cook County Sheriff's Men's Addiction Recovery, or SMART program, working to cut themselves off from the demon of opioid addiction. Walton just completed the 90-day program.
It's going to take a lot of resilience, a lot of commitment, durability, adaptability when we get out of here, because life is not going to be easy when we get out of here. For once, I feel like you are not your mistakes. Yes, we made mistakes in the past, but that does not define who you really are.
It's like I was a slave to opioids. The main thing that I learned since I've been here was patience and humility.
Keith Bolden has been in the program for 59 days, and over the past 3 years, he says he's seen 35 people die from opioid overdoses. He says the first step to recovery is the hardest.
I'm blessed because I could have been a statistic also, so I have a bigger purpose.
Renew your mind.
It's a combination of group therapy, other therapeutic intervention, and, if needed, medication-assisted weaning from the thrall of opioid addiction.
We have medical screeners who are screening them for substance use disorder, for any signs of withdrawals.
Cermak Health Services Dr. Priscilla Ware says this is the only such accredited medical opioid treatment program at a jail in the state. Supervised detox done right on the detention campus.
I think as a society, we have to start looking at substance use as just like the person next door to you who has diabetes and the person who has hypertension and heart disease. And once as a community we start recognizing that, then we quickly realize that these are patients that we also have to take care of.
In Cook County, the number of opioid deaths over the past 6 years is nearly double that of homicides. 9,791 opioid deaths compared to 5,269 homicides, including last year's preliminary data, which is why Sheriff Tom Dart says a program like this is vitally important to save lives.
So much of it, though, does come down to just sort of basics of caring and trying to see these folks as folks who have all sorts of potential if we can get them through the substance abuse issue that people on the outside suffer through as well.
Lives like Jeannie Lockett, who says she was addicted to heroin and tried to OD, but is now in the women's opioid treatment program, Thrive.
It's not too late. You still got time, because God ain't letting you be here for long. We never know when we're gonna leave this earth, so you still got time. So while you got time, just go ahead and give yourself a chance.
Powerful message there. Sheriff Dart says the nearly 200 inmates in the opioid treatment program are released with a discharge plan and connections to opioid treatment services in the county, and they're also given naloxone. And there are resources in the community to help you or your loved one with opioid addiction. We've got a list of those resources right on our website. 3,000 people have gone through this program in the Cook County Jail since it started about